I'm Jessica. I'm going to be your nurse today.
Okay.
This is Rachel. She is our 46-year-old female patient. I'm going to be doing an assessment of her chest, lungs, heart, and blood vessels. So first I'm going to just start by inspecting her chest and her thoracic region. I'm going to be noting her thoracic landmarks such as her suprasternal notch, her clavicles, her xiphoid process, her manubriosternal junction, and I'm going to be noting them for size, shape, any abnormalities which all appear to be within normal limits. Then I'm also going to be assessing her just her chest appearance for her skin color, the superficial venous patterns, which all appear to be within normal limits. I'm going to be assessing her chest for symmetry, which, if you'll just relax, please, appears to be symmetrical. And then I'm also going to be just assessing the prominence of her ribs, just inspecting. And then next what I'm going to do is evaluate her respirations for 1 minute, and I'm going to be noting for her rate, rhythm, and pattern. Okay, and her respirations were 12. She has a normal rhythm. 12 respirations is within normal limits. While she's breathing, I'm going to assess, if you will take a couple of deep breaths for me, just in and out. I'm going to be assessing for her, for the movement with breathing. It appears to be symmetrical. There's no abnormal bulging. There is no use of accessory muscles. She appears to have a normal breathing pattern. So next what I'm going to do is I'm going to I'm going to also be listening just for any audible sounds such as stridor or wheezing, anything that I could hear without my stethoscope, and she has no abnormal breath sounds. So then next what I'm going to do is palpate her chest for symmetry. Okay. And I'm going to have you turn to the side a little bit, and I'm just feeling to make sure everything is symmetrical. Just palpating for symmetrical expansion when she breathes. Feeling any type of sensations such as crepitus, grating, or vibrations, which I do not feel any of. She appears to be within normal limits in that area. So I'm going to also feel for her chest pulsations. Okay, appears to be within normal limits as well. So next what I'm going to do is assess for tactile firmitus, which I'm going to have her turn again, if you can face that way please, and breathe. I've got both of my hands flat on her back, and I'm going to ask her to count to 10, if you would please.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, and I feel a gentle vibration, which was the expected finding. So next what I'm going to do is I'm going to perform direct and indirect percussion on the chest, comparing sides for diaphragmatic excursion, percussion tone, intensity, pitch, duration, and quality. Okay, So I've got my hand flat on her back, and I'm just gonna that. I'm listening. Just noting any dull or resonant sounds. And over to the front and do the same. Okay. So next I'm going to grab my stethoscope and I'm going to listen to her chest. Also comparing for intensity, pitch, duration, quality of expected breath sounds, listening for any unexpected breath sounds. If you would turn to the side again, I'm going to start. I'm also going to take note that both sides sound the same or different. Take a deep breath for me. And I'm actually noting some wheezes in her upper lobes bilaterally. I believe you are a smoker, correct?
Yep.
Okay. So I'm hearing some faint wheezes, inspiratory wheezes. Okay. So next what I'm going to do is assess for vocal resonance by listening to her again, and I'm going to have her recite numbers, count to 10, and listen to hear the quality. Okay. So if you can count to 10 for me.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay. And the sounds are indistinct, which is a normal. Next, I'm going to move on to her heart assessment, and I'm going to start by just inspecting her pericardium for her apical impulse. I'm going to be looking for any pulsations, heaves, or lifts, and then which appears to be normal, within normal limits. So next, I am going to palpate the pericardium to detect for apical impulse, thrills, heaves, or lifts. So I'm just going to begin palpating, feeling for any pulsations, heaves, or lifts again. Sorry, I know this is a little bit uncomfortable.
It's okay.
And her apical pulse was palpated and within normal limits. So next I'm going to use percussion to determine the heart size. So I'm going to begin here. And then I'm going to go under here. Okay. Okay. So next I'm going to listen to the 5 areas of her heart. Excuse me. To assess for her rate, rhythm, S1, S2, S3, and or S4, splitting murmurs. Just assess her heart. Okay. And while I'm listening, I'm just noting S1 and S2. No murmurs were heard, which is a normal finding. So next I'm going to have her lay down and I'm going to assess her blood vessels, starting with her peripheral arteries. So I'm going to take your shoes off. Can you take your shoes off? Both shoes, please. Okay. So I'm going to feel of her dorsal. I'm just noting for rate, rhythm. Are they weak? Are they thready? Are they bounding? Probably two. Okay. And her brachial artery. Okay. So they are strong, not bounding, within normal limits. All of them were palpated. And next I'm going to listen to her arteries. I'm going to start by listening to her aortic artery using the bell of my stethoscope. I'm assessing for a Bruit. Then I'm going to listen to her right renal artery. Noting again for any Bruit. And her left iliac artery. The right iliac artery. Listen for her to her left femoral and her right femoral. And again, findings are within normal limits. So I'm going to have our patient lay at a 45-degree angle. So I'll move it up here. I'm going to elevate the head 45 degrees. Okay. Now I'm going to be assessing for jugular venous pressure. Any pulsations, I'm just inspecting, noting, and I'm also going to be looking for any distension, which appears to be no jugular distension. So that's within normal limits. So next I'm going to move on and I'm going to inspect her extremities. And I'm going to be looking for the sufficiency of her arteries and veins just by looking at the color of her skin, which appears to be within normal limits. It's, pink. I'm going to check for capillary refill. Okay, and then I'm going to just feel her skin texture. Her skin is warm, her skin is dry. Her skin turner. I'm also going to be looking for any varicose veins. So I would her pant leg here, and I'm just looking. She does not have any varicose veins. So I'm also assessing for edema. She has no edema to either lower extremity, no edema to her upper extremities. So I'm going to feel on any superficial